Hello everyone, myself Shivangi Manoj Patel. I am third year BPT student. Today I will be presenting about the ASIA scale. So the full form of the ASIA scale is the American Spinal Injury Association scale. It gives outcome measure for the spinal cord injury. So the parameters on these scales are sensory and motor levels, which is on the both left and right side. Second is the neurological level of injury. Third one is the sensory score, in which we will perform pinprick and light touch. Fourth one is the motor scores for both the upper limb and the lower limb. Then another is the zone of partial preservation. And the last step is the ASIA impairment scale. Here it is the scale which is shown in the screen. We have 28 dermatomes in our body. We have to check 28 sensations in all the dermatomes. We will perform first light touch and then pinprick. In pinprick, we will use a safety pin for sharp and dull touch. Now I will perform the sensory examination. I will check her sensory examination on all the dermatomes. I will touch on your skin. You just have me the answer yes or no if you are feeling the pain or not. I will check for the light touch. Here for C2, I will touch here. You feel? This is for the sensory examination of light touch. Now I will check for the sensory examination of pinprick sensation. Here, this one is for the sharp and this one is for the dull. First I will check for the sharp one. Now I will check for the dull one. This is the procedure to check for the sensations or the sensory examination of the patient. Perform for the motor examination. For motor examination, we have to examine all the myotomes of the upper limb and the lower limb. So first of all, for the upper limb, ask the patient to bend his elbow or flex the elbow. And ask the patient to extend her wrist. Ask the patient to extend her arm. Ask the patient to flex her fingers. Ask the patient to do abduction. So this one is for the upper limb. Now I will check for the lower limb. Ask the patient to do the hip flexion. Now ask the patient to do knee extension. Now ask the patient to do the dorsiflexion. Ask the patient to do internal rotation. Then ask the patient to do the plantar flexion. Now, grading of the light touch and pinprick. 0, it is absent. 1, it is altered. And 2, it is normal or intact. Now, coming towards the deep anal pressure. So we will perform this. The patient will be in the sideline position. Therapist have to apply the pressure on the anorectal wall by index finger. Ask the patient that he feels or not. The answer of the patient will be in yes or no. Now, gradings for the motor examinations are: grade 0, there is no contraction. For grade 1, there is flickering contractions. For grade 2, full range of motion with eliminated gravity. Grade 3, full range of motion with against gravity. Grade 4, full range of motion with against gravity with minimal resistance. And the grade 5 is the full range of motion with against gravity with maximal resistance. These all are the grades for the motor examination. So now the last step is the Asia impairment scale of A. Complete no sensory or motor function preserved in S4 to 5. B is the sensory incomplete sensory but not motor functions preserved below the neurological level. And C, motor function incomplete, motor function preserved below the neurological level. Grade 3 is less than 50%. Sorry, it is greater than 50%. For D, motor incomplete motor functions preserved below the neurological level, that is grade 3, is greater than the 5%. And for E, it is normal. So this is all about the Asia scale. Thank you.